Today, we're going to continue our conversation on whether Wisconsin has any coverage gaps. We started this conversation through the lens of public benefits the other day, and we are going to share the link to that video in the description below to get you up to speed on this conversation. And we look through the lens specifically in Wisconsin of Badger Care Plus, that myth that Wisconsin has no coverage gaps because if you're low enough income, you can get Medicaid, and if you're a little higher income, you can get private insurance. And we know that that's a political statement, but the reality is that huge gaps exist, especially for folks trying to navigate the eligibility for public benefits programs. Well, we're continuing that conversation today, but through the lens of private insurance. Let's look at those people that are over 100% of the federal poverty level and see what the gaps really are for those folks. And some of them are quite apparent, but we'll spell it out. Now, the way that this conversation started bubbling back up again in Wisconsin, even though this was old political rhetoric from our last administration, was in the context of Medicaid expansion. There were political statements being made that we don't need Medicaid expansion in Wisconsin because everybody's got insurance. Now, this conversation happens in a different context as well. As we start looking at and evaluating conversations about Medicare for all, there are some critics that say we don't need Medicare for all because everybody's already got insurance and we don't have gaps. So we're going to look specifically at private insurance and what those gaps might be. Now, like we said, lower income folks, if you're under 100% of the federal poverty level, on the books, there's eligibility for Badger Care Plus in the state of Wisconsin. If you're above 100%, the instruction is to start looking to the marketplace for private insurance. And for some people, that might mean also, therefore, tax subsidies. But we know that people still remain uninsured, and therefore there are still coverage gaps. If you look nationally, we're talking about 10% of Americans, which is 27 million people. Half of those are technically eligible for the marketplace with subsidies, but they're not being connected. And a lot of people, if you ask, are going to say the biggest reason why is because just like with public benefits, they're getting caught up in the rules of eligibility, and for many more people, cost. So even though you may be technically eligible, that coverage gap still exists because you can't afford to pay for that insurance. Either the premiums without subsidies if you don't qualify for tax subsidies, or the out-of-pocket expenses like deductibles, co-pays, co-insurance that might be cost prohibitive. We also have some little policies deep in the weeds, like the family glitch, where you may be evaluated for affordability based on the individual-only plan at your workplace, even though you're trying to get family coverage, and it's just not affordable. You don't, therefore, get the benefit of extra subsidies. You can't afford it. You, therefore, remain uninsured. Then we have people that are churning on and off of coverage, but just so happen to be in a period of where it is not open enrollment. So the window of actually applying for benefits is quite small for you, and you may not be eligible for a special enrollment period. So we have people that are uninsured just because they're in the gap of that timeline where they just can't connect to insurance. There are also the people that are on the edges of eligibility and just don't know which way they should be looking. In Wisconsin, we have a gap filler process for people that are churning off of Badger Care Plus and onto the marketplace and vice versa, where the rules just calculate your income differently enough and you don't know which way to go. Some people find their way through that maze. Most people, however, do not. So if you're really close to 100% of the federal poverty level, for example, you might be uninsured, not knowing which way to look. Now, then we're not even talking about some of the gaps in services, the service denials, or the wrongful denials, and things like people trying to access services and being told it's not covered. It's not technically a coverage gap. Your coverage just isn't working for you. So we have that end result being the same of people not connecting to care because they couldn't figure out their coverage or how to navigate some of the wrong decisions being made about their coverage, which just throws people into the pot of the virtually uninsured. Now, we talked about people not being eligible for tax credits in the marketplace as one of the reasons they might not be connecting to healthcare coverage. It might make the coverage just too unaffordable. And a lot of people would wonder how that could happen. How could you not connect to the tax credits you might otherwise be eligible for? And the first reason for about 4 million individuals, I think it's now over 4 million individuals, is because of the immigration status requirements in the marketplace. Marketplace's immigration status is that you have to be lawfully present in the United States. Some people don't know that, so they just assume they're not eligible. Other people don't fall into that category of lawfully present and therefore are virtually uninsurable. They can't find their way to the marketplace, and they can't find their way to most state Medicaid programs. Now, other people are not eligible for tax credits because they had an offer of employer-sponsored insurance. And even if they didn't take that employer-sponsored insurance, that is prohibiting them from getting the tax credits in the marketplace. They could still buy insurance in the marketplace. They just couldn't get the cost savings that comes along with that because of that access rule. That's keeping millions of people from actually having affordable insurance. And finally, due to income, another big reason people might not be eligible for tax credits. And that goes both ways. If you're under 100% of the federal poverty level, you're not eligible for tax credits because the theory is you should be taking a Medicaid program, but we know a number of people get denied that Medicaid program and therefore are uninsured. But it also works on the higher end of the income spectrum, people over 400% of the federal poverty level, not able to connect to tax subsidies to bring some of that high cost premiums down, and therefore they go without. There are other private insurance considerations that we address in separate videos, like surprise medical bills, conflicts with networks, adequacy of networks, billing considerations, and cost. Again, part of that bigger conversation of what's keeping people from actually using coverage and getting care. And the way through all of this is appropriate navigation and making sure people know their rights and responsibilities. And there is always a need for us to do better at that, to reach more people, talk about the considerations, and make sure that they can find their way to the best coverage system for them, and also the one that works for the specific needs that they have. In summary, there are opportunities at every step of the way to lose coverage or to have gaps. Eligibility criteria, things like immigration status, the cost, networks, things that are keeping individuals from connecting to the coverage they need, and therefore the emphasis should be on consumer support, consumer assistance, and connecting individuals to the care that they need. Now, we know the opposite of that is this increase in uncompensated care, people going without insurance, waiting until the very last minute when they're at their sickest to seek out emergency care, the most expensive way to use the healthcare system. That in turn just drives the cost up for everybody and then drives the cost of insurance up for everybody. We can do better at making sure that there aren't gaps in the system, but we definitely have debunked the myth that there are no coverage gaps in the state of Wisconsin. If you have questions about private insurance and how eligibility rules work, or if there are gaps in your state in healthcare coverage for all people, you can send us an email or read some of our materials at healthwatchwisconsin.org.